This is KBZE General Manager Howard Castay, and with me right now is Mr. Darren Grubb of Medicare Advantage. He's a Medicare Advantage majority spokesman, and he's here to explain the difference between Medicare and Obamacare. He's also here to explain what Medicare Advantage is all about, and frankly, how he can, or rather, his organization can help folks apply for Medicare and use Medicare along with their health insurance. So, without any further ado, Darren, I'm going to turn it over to you and just let's get into it. Tell us the difference between Medicare and Obamacare, and then if you could start explaining what Medicare is and how your organization can help folks.
But before we get started, it's easy to conflate for a lot of people the Medicare Advantage conversation with what's going on in Congress right now, which is the shutdown as a result of folks not agreeing on what to do with the ACA and Obamacare and the like. That is, they are two different conversations, but I can kind of help spell that out. The ACA conversation is like healthcare coverage right now, right?
Right.
Medicare and Medicare Advantage is the conversation seniors pay into the system their entire working careers. That's taken out of every paycheck, right? And the expectation is by the time they reach 65 and they retire, there's going to be money there within the program that they can begin to accrue the benefits that they've been paying into the entire time.
Okay.
So they are
All right.
they are two separate issues, but that's what we're here to talk about, just how to strengthen and protect the Medicare Advantage. Yeah, absolutely, Howard, and great to be with you. Thanks for having me on today. I appreciate it. So there is a lot of conversation in DC right now, and it's an issue that has driven in large part the current government shutdown that we're seeing, and that is the debate and consideration over the Affordable Care Act, which is also known as Obamacare, which is a market option for your healthcare needs. And so how to fund that, who it benefits, and the like, that has been a conversation for quite some time. That is separate and apart, though, from the Medicare and Medicare Advantage discussion. Medicare, of course, is the program that seniors have paid into their entire careers. Every paycheck there's a deduction that goes toward the Medicare program. Often companies or your organizations will underwrite part of that as well. And the theory is that there is going to be, once a senior turns 65, that he or she can choose the Medicare program that best fits their needs to help them in their retirement. And again, so we feel this is something that is critical to the millions and millions of seniors around the country, including the 34 million seniors around the country who choose Medicare Advantage. And Howard, as you may know, in Louisiana alone, more than 540,000 seniors, 56% of your eligible Medicare senior population choose Medicare Advantage. And so it's the majority of folks in Louisiana who have chosen the Medicare Advantage program. And the appeal of Medicare Advantage is that it delivers comprehensive and high quality, affordable care that goes beyond traditional Medicare. And so Medicare Advantage bundles really all the best elements of the Medicare program. So includes benefits like dental coverage and vision coverage, hearing, in-home care. And unlike traditional Medicare, Medicare Advantage provides prescription drug coverage and a cap on out-of-pocket costs, which gives seniors financial peace of mind, especially during these high-cost, high inflationary times that we're in right now.
So, how does someone apply to be a part of Medicare Advantage majority?
So a big component of the Medicare program, and something we encourage, a big component is choice, right? Seniors should do their homework, do their research, talk to their caregivers, talk to their doctors to understand what option is best for them. Many times Medicare Advantage attracts people from every income level, but those seniors who have multiple chronic conditions, whether it's heart disease or diabetes or high blood pressure, things that have to be managed, they choose Medicare Advantage because of the comprehensive and integrated care coordination that comes with managing those types of issues.